You can start, sir.
Hello and good afternoon, everyone. My name is Kamal Narayan and I am CEO of ISW Council. Today we are back with our special series of care during lockdown. And today we will be discussing about two important friends, COVID-19 disease and subsequent lockdown have caused disruption in many areas and it has impacted our lives in many ways. It has also disrupted many patients who were requiring going to the consulting to the doctors and PCOD also are among the same, which may be causing a lot of concern among certain set of patients. But because of we cannot access healthcare as usual, we may have to so today very a kind of powerful esteemed panel of our speakers, and I'll introduce all of them one by one and then listen. We have Dr. Geeta Haripriya, Chairperson, Multi-Specialty Hospital and Medical Director, Prasant Fertility and Research Center, Chennai. We have Dr. Kaveri Banerjee, Medical Director, Advanced Fertility and Gynecological Center, President, ISAR, Delhi Chapter. We have Dr. K.U. Kunji Moideen, Founder and Managing Director of ARMC IVF, President of Parenthemal Society and Joint Secretary of Indian Fertility Society, Kerala. Sorry, doctor, if I might have pronounced it badly. I will correct it later. Dr. Sujoy Das Gupta, Consultant, Reproductive Medicine, Genome Fertility Center, Kolkata, and Dr. S. Krishna Kumar, Chief Consultant, JK Women Hospital, Vice President, IAGE, and Secretary General, ISAR, Mumbai. Dr. Durga Rao, co-founder and medical director of Oasis Fertility, Hyderabad. Dr. Sivani Sachdev Gaur, founder and director, SCI, and Dr. Milind Patil, director, Sobha Nursing Home and Sobha Test Tube Baby Center, Solapur. All experts, doctors, to this special show where we are trying to address the concerns and queries of people accessing infertility care or women and women having concern related to PCOD. I'll start with fertility. What is the volume? How many patients you think are accessing treatment related to infertility, may be facing challenges during this time, and how or the care while we are in lockdowns? Dr. Haripriya.
Yeah, see, on a global perspective, if you take the generally quoted figure is 12 to 15% of infertility. Everybody was going to their practitioners all these days, but now because of the lockdown, this is not an. First, we don't want people moving out of the house, so most of the consultations now are online. So you can only consult in polycystic ovaries about weight loss and other things. initially we completed what we had pending, and to improve. So till such time, it will only be phone for some things which can be managed intercourse. Those sorts of things be done, or reducing weight. But the actual procedures we cannot do till the lockdown. And even
So
after
you
that, not only the lockdown is over, but after that we don't know if a lockdown is for. So
yes,
it's
yes.
unpredictable for the time being.
So that means, doctor, the set of patients who are accessing healthcare or were supposed to take the treatments related to infertility are going to have some time of uncertainty. They not the next cycle of treatment will happen, or when they can again get the medical assistance, which require physical interventions as well. Let me take Dr. Kaveri Banerjee in between. Dr. Banerjee, how do you see that this continuity of treatment, of infertility patients was followed up before, uh, the corona outbreak happened, and what is the scenario now, and how it might have impacted uh, their chances of outcome, or their mental state also, because it might have added certain concerns to them.
See,
Dr.
essentially, as Dr. Geeta has just mentioned, it has become quite unpredictable at the moment. So, if we divide the infertile couples according to the various categories, one is your young couples who have PCO, mild unexplained, mild endometriosis, tubes are open, they are young. The other is those couples which need some form of surgical treatment, like they may have a fibroid, they may have deep endometriosis, adenomyosis. And the third group of patients is we are very sure we need IVF or some form of ART in them. So, if we look into the first category of patients where the tubes are patent, they are young, especially in the cosmopolitan setup where otherwise everyday stressful activity, work, everything was there in the pre-COVID era. And now everyone is at home in lockdown. Of course, many are working from home. But in this, so as to say, green category of patients where medical treatment can work, for example, you have polycystic ovaries where you can have lifestyle changes, weight reduction. In mild oligoasthenospermia, you can give antioxidants. You can try to be as stress free as possible, follow the natural rhythm of the cycle. So, I think for this subset of patients, this era or this time period may come as a boon if they take it in that spirit and if they get the right consultation from their medical practitioners on teleconsultation and guide them, and this time actually can be utilized by this group of patients. However, you have the other groups of patients where there could be a large fibroid that is causing pain, adenomyosis, endometriosis that needs surgery, and for them it has been on hold and therefore their treatment is being deferred. And so is the case with IVF and ART. Like Madam Geeta just said, that 3 weeks is fine, everybody can wait. But now it has become unpredictable and indefinite kind of a thing. So we are getting calls from these group of patients as to doctor, when can we start our treatment? And right now we are following the ASRM H-ray guidelines. Even IFS has come that fresh cycles cannot be started. But I'm very sure that in a few weeks' time, people will get together, leaders in this field and develop protocols as to how soon we can start treatment safely for this category of patients. Mr. Narayan, I've given my answer. I think there's something wrong with your internet. So while Mr. Narayan is taking time to come on board, there was a few discussion before the meeting started as to what is the risk of this virus onto couples who are trying to get pregnant. And for that category, people, there has been guidelines that IVF cannot be started, and the reason could be that you are getting too many patients to your center. You may not maintain social distancing, and the virus may spread. But the question is, can natural fertility continue? Can we have natural conceptions? Is this virus as strong as the Zeta virus that was there before? So definitely the information is less, but I think the only chances have been of preterm labor, but none of congenital malformation or miscarriage as yet. So natural conception, so far nobody has said that we can stop the natural conception at the moment. I will request Dr. Shivani and Dr. Geeta and Dr. Durga to please unmute themselves and give their views till Mr. Narayan comes on board. Sir.
Yeah, now the present situation is really a virtual war against an unseen enemy. Everything is unpredictable as far as how many people are going to be affected, we don't know, and what is the nature of the disease. How are we going to face that crisis? How are we going to treat an individual person? Forget about infertility, for the disease itself. Nothing is new because this is a very 3-month-old history. So we are all waiting for those results, and government rightly has stopped everything. Means right now they said that you just survive. That's all. You buy your basic needs and nothing apart. Don't meet friends, don't meet relatives, cancel marriages. Everything is secondary than life. So definitely any plant surgery, any plant treatment where infertility falls into that category has to come to a hold, because we have to give time to the government to build the infrastructure, health infrastructure, how it is going to be hit, how many beds are going to be required, and what will happen to health workers. See, the very idea of not letting regular patients come into a clinic is, of course, from the patient's point of view, less exposure to them, less chance of them getting infected. But the main is we health workers, we also should have be very healthy and not have more chance to get affected. So imagine people coming from every corner of the city or every corner of the area, and you don't know what the exposure is. So the health worker basically has to be right now fit enough to tackle the emergency. So that is where we are all standing and waiting and obeying the orders very clearly. Now, as you rightly said, premier bodies dealing with infertility has clearly given guidance, like Indian Society of Assisted Reproduction, Indian Fertility Society, the American Society of Reproductive Medicine, the European Society of Human Reproduction and Embryology have all, way back in March, I think 5 weeks before only, the guidelines have come, and most of us had to adhere to it. Only those cycles which were already on, just complete them, and even in those cycles we have all been advised to freeze the oocytes or embryos rather than go for fresh embryo transfer. So that was the right way to do. So every other cycle, like say frozen embryo transfer, which we had prepared or we were starting, that also was advised that please don't go ahead. So that was all a necessity warning to everybody to understand the disease. So first understand the disease. Now, as far as how it is going to affect pregnant patient is again unknown. Though there are studies which are very small studies which has come down from China and few from Italy, where pregnant patient, how serious it will be and what take care will they need. So definitely somebody getting pregnant and getting tensed that if I get infected today, she is infected, they continue. Yes, the suspense is not going to be solved easily. as you rightly said, the leaders will have to sit down and take the stock of the situation as to from the whatever the experiences and how to go about it, how soon can we go about it, or we need to be slow in treatment for infertility couples. Even after the lockdown is all going to be a little suspense, and I think only time will tell us. We won't be clear as of now, and we can say we can start the treatment and by May end I'll have my first batch. I don't think nobody can conclude. Moreover, all the media, the disposables, all the injections which we get, all depend on air transport, road transport, which all have been halted, and it has been right now only for essential goods. So right now we do not know from that point of view also. So that is where the suspense is as to how do we go. But definitely we will win the war ultimately. But I think patience is the key here, not only for us, but yes, as Kaveri rightly said, there are a group of patients who will require more urgent treatment and they'll be more stressed. So from that point of view, how are we going to go ahead or tackle, and whether whom can be tackled will all be a question which will be debated, and answers for that will have to be found soon.
Dr. Kaveri, I think your question also was about what do we advise regarding natural conception. Am I right?
Yeah.
That's correct. That's correct, Dr. Durga.
So this is where I think, that's a very diabolical thing to answer, because frankly, it also depends on whether the woman is coming from these kind of hot zones or the ones which are containment zones. Now, when a woman, even if she naturally conceives, obviously is required to take some kind of antenatal care of the best standards that are possible. But suppose a woman is, in any of these contained areas, it becomes pretty difficult for her to access the right kind of healthcare. Because whenever they are going to any of these nursing homes or the hospitals, it tends to become a very rigorous thing when a woman is coming from any of these hot zones, and, in terms of isolation, the care that they receive and the kind of advice that they get. So if anybody is coming from an area where the infection seems to be high and the risk is higher, I'm wondering whether it's very prudent even for that woman to try naturally. Anyway, when it comes to assisted reproduction, like you rightly said, the doors are closed. We haven't thought about when we can open and how we go ahead. But even in the natural conceptions, I'm not so sure that, things are going to be very easy for a woman to access healthcare as well at this point in time. And if it is a high-risk pregnancy, obviously she needs the best care possible. And in these circumstances, how easy it is for her to access it is always a question.
Yes, ma'am. Thank you very much. What I would like to say is to people who are listening is that right now, all the people who are practicing infertility, there is only one category of patients that we are able to treat right now. So if you have been diagnosed with cancer and if you need to freeze your sperm or your eggs, that is the only treatment that is being done right now. And the gametes which are frozen, the sperm or the egg, is being kept very separate in a separate vessel so as to minimize any risk of infection at all. And because I've been reading a lot about all this, what is being stated is that the virus, these coronaviruses, they sit on what is called as a receptor. It is like a chair which is present on the egg and on the sperm. So what is being found is that if these ACE2 receptors, they are not present on sperm, they are not present on the egg. However, they are present on the premature form of the sperm. So right now, the data is very less for us to know whether this is going to be transmitted to the egg, through the sperm, to your baby. Is your baby going to be a carrier? If you get pregnant at this time, will the child be a carrier later? That is very difficult to know. But try and understand, if you do decide to get pregnant at this time, you will have very little support from any family member. You will have very limited access to medical care and very limited access to any procedures that you might need. So that is one of the problems. So you have to weigh the pros and cons. Secondly, a lot of couples come and tell me that we are working in different jobs. In North India here, there are so many people who are working. One is in Noida, one is in Gurgaon, one is in Delhi. We are together right now. We have this opportunity to get pregnant. So I tell people it is a personal choice. You must understand all the factors involved, and then you can decide. And when the services do open, there are certain people whom we are going to give priority. So who are these people? It's going to be the women who are in an advanced maternal age, or people who have been under preparation for many months, whose gametes are already frozen. These are the ones who are going to go back into treatment first. And of course, all our antiseptic procedures, disinfection of the lab, cryocan usage, everything is going to be different, and it's going to change after the COVID era.
I think Kamal Narayan is back. You can.
Hello.
Yeah, you can take over. You can take over.
Sorry for
Welcome back.
internet.
Welcome back, Kamalji. We were missing you.
Yeah. So
you can conduct the program further. Yeah.
Today, I don't know, what questions Himani and have already been covered. So I would request that to continue with the
No, you asked the question. We just covered something like how natural pregnancy, whether they should be allowed, not allowed, forget about the treatment.
Right.
Yeah.
All right. So then let me go to Dr. Durga Rao, and my question would be then to when we are going to postpone the cycles during the lockdown, how it is going to impact the possibilities or outcome in terms of having a child or ability to have a child for these patients who are undergoing these treatments.
So your question is about once the lockdown eases and we are able to come back to work, how do we organize our work? Is that what you're asking us, Mr. Kamal?
No, I'm asking about the patients. So those patients who are missing on their, let's say, IVF cycle or infertility care cycle, is it going to impact their ability to bear a child?
See, it depends on what category of infertility they belong to. So in terms of time, obviously the two categories that are time very sensitive are the ones who are older, the women who are older. And the second category is people who have obviously less ovarian reserve. But having said that, even though these two categories, when we are really looking at it, we can find loopholes in what the ASRM and everybody are telling us in terms of the kind of people that can be treated. The question remains that since it is going to be for a couple of months, or rather it's almost close, I'm hoping, within a couple of weeks we'll be easing the lockdown. When we really look at, whether we should do any treatments now or wait for the lockdown to ease, I think it would be prudent for us to wait for the lockdown to ease before we even start treatments on these two sensitive categories of patients. Now, if they are malignancy, then it's a different situation altogether. It is prudent for us to do the treatments for them as soon as they're diagnosed so that, we don't waste time for them. But the other two sensitive categories, in a woman being much older or even the one with the low ovarian reserve, looking at the fact that we will be delaying treatments for possibly another 2 to 3 weeks, I think it is prudent to wait for the lockdown to ease before we even start treatments on them. And they would be my first priority in terms of going through the fertility treatments. The reason why I'm saying I would like the lockdown to ease before I even start treatments on these two sensitive groups of people is, it is a teamwork. It is not just me going and opening an office and starting to do things. The question is the kind of protocol that needs to be set in place even once the lockdown eases. We have already created a guidelines for our offices in terms of what needs to be done for the patients. How do we keep our staff safe? How do we keep the patient who's coming into the office also not get exposed to any kind of infection? So there are certain precautions and protocols and SOPs that have to be put in place even once the lockdown eases, because this situation of COVID is not going to disappear once the lockdown eases. This is going to be there for probably another 6 months to a year. So it's going to be a completely different way that we will have to handle healthcare nowadays in this situation. So I would say that wait for another 2-3 weeks, let the lockdown ease, and then look at the more sensitive categories of patients who need treatments, and they will be our priority. Coming to the second part of the question, which is, should we get them pregnant ASAP? I would still advise caution on that aspect. Even when I were to start the treatments for the two sensitive groups, I think my advice at this point in time would be, let's take the oocytes out, create the embryos, vitrify them, definitely vitrify them and put them in a tank that is going to be separate for the group of people that we are treating in this era. I wouldn't want the embryos that we are going to be creating now to be included in the tanks that was there pre-COVID era. So I would still wait and see what the situation is before I go ahead and do embryo transfers for them. But I would want to actually start at least the treatments in terms of creating the embryos and freezing them once the lockdown eases. I hope I answered your questions.
Thank you, doctor. So you talked about that there are going to be certain guidelines how your own clinic or how healthcare setups are going to operate post the lockdown is opened, or let's say at a restricted extended lockdown also. So when it comes to guideline, now I'll like to get in Dr. S. Krishna Kumar here. Doctor, what do you say and what do you feel are should be the guidelines for the infertile couples during this period? When we as a healthcare providers are thinking of guidelines which will be followed post we come back to our work. What kind of guidelines you would prescribe for these couples to follow at home or maybe post that? Dr. Krishna Kumar, you there?
Yeah. No, at this point of time, it has been very clearly mentioned that every infertile couple has to take rest. There is, unless they are having no subfertility problem, they want to try at home, they can go ahead and try. But as rightly pointed out by Dr. Durga Rao, that about antenatal care and all those things, how are we going to offer? So as of now, we cannot tell patients that don't get pregnant, because we do get calls from women who are pregnant at this stage and they said whether I go for termination. Now the advisors, I would say, I cannot say go for termination, but then go ahead, but then at least follow all those basic hygiene principles, the social distancing, and whatever possible by teleconsulting we can go ahead and do, and restrict the sonography which is required throughout the pregnancy. Right now, certain points we have to do, and we will do that. There is no point. But as far as infertility treatment, I think most of the major societies all over the world, in India, have clearly said that as far as possible, all infertility treatment should come to a standstill, because government has given guidelines that no general surgery, no routine surgery should be carried out at this point of time, because we don't want people to get exposed. We don't want health workers to get exposed and get infected. So as of now, guideline will be just be cool, don't get tensed. Yes, there are a few couple who will be stressed out, but use this time for certain things like polycystic ovarian disease patients. Patients with PCOD have their own peculiar problem. Apart from infertility, they have other problems. Weight gain or weight is one of the major issues. So maybe that guideline I can tell to my PCO patient at this point of time.
We'll come to the PCOD maybe later. So,
okay.
so let's discuss more about. So you talked about there is not a very specific set of guidelines, but you do recommend them to have maximum rest and focus on their other activities. Maybe look for improvement on other lifestyle areas.
Lifestyle, reduce their stress, do yoga. Yeah. All those factors, excepting patients who are on cancer treatment, they require, we can offer. That is the only guideline we have, that we can offer them treatment. That is all.
So are there going to be any guideline, Dr. Shivani? May I come to you, and then are there going to be any guideline for the patients who are going to continue their infertility treatment post lockdown? How you are going to tackle those patients?
Oh, I'm sure there are going to be not guidelines, but very extensive guidelines. The guidelines are going to deal with not only just patients, but the entire disinfection of the IUI and the IVF laboratory, how we are going to wash our gametes, eggs and sperms, and how we are going to freeze. Try and understand the commonest disinfectants you are using, this 70% alcohol. We do not even let it enter inside our clinic, because just the fumes of that can kill our gametes. So be rest assured that our field of infertility is so sensitive that we are going to have a whole new set of guidelines. It's going to be like a big fat collated guidelines. And right now, what I tell couples is that think of this as a chance. It is an opportunity you have that you may never need to go to an IVF center, because it is in the last 2 weeks, in fact, 3 of my patients have called sending their urine pregnancy test kits that they have got a positive pregnancy test. Now, the most important thing for them will be that to take some supplements, whichever the doctor advises. Be in touch with your doctor on the phone. Contact your doctor, take the supplements, the multivitamins which are advisable, and every day, please make sure you exercise. So these are the guidelines that right now we are following, which we are telling our patients. And once the centers open, guidelines will include cases where we have done preparation for 2-3 months, their gametes are frozen, or somebody with advanced maternal age, somebody with poor endometriosis and a poor ovarian result. These are going to be the women who are going to get a priority. They will be bumped up. They are going to be first in the line. And Krishna Kumar sir, he is going to be one of the main person who's going to be formulating these guidelines. So it is great that we have him here with us in our panel today.
Wonderful. So doctor, you highlighted something very important. You said that the 70% alcohol-based, sanitizers and all, which are becoming new normal, and people are, they are supposed to use this multiple time. So let me just take this question to that Dr. K.U. Kanjimoiduin. Doctor,
Yes.
what do you think that when these new in new scenario, when we will come back to our hospitals or clinics and there will be a strict guideline related to hygiene and all, is it going to put the quality or the safety of frozen sperm, embryos or eggs at risk because of this overall COVID-19 pandemic, or the kind of hygiene restrictions post that?
Yeah, of course. It can affect the overall environment in a RT lab or an IVF clinic to a great extent. Because initially, for example, I am from Kerala, initially, much before the national lockdown, here the government has instructed the lockdown of all clinics, nursing homes to lockdown for the elective cases and the infertility treatment. So right from that point, all this personal hygiene, hand sanitizers, everything have been used. And the government and the local authority were advising to rather clean the waiting areas, fumigate the areas very often. So all these can create a lot of VOCs. And all on a sudden, we should not start open the IVF lab, IUI lab, or all these gamete handling units, because it can affect the situation very badly. And initially, we all expected that this lockdown might be over after 3 weeks, and it has been extended for further 3 weeks. And till a vaccine or some drug of choice come out, this will not settle the issue. So this is going to be a never-ending issue, at least for next 6 months to 1 year. So all these issues, considering because at present we have only the option of social distancing and this personal hygiene. So we have to use all these VOCs and the products which have been prepared from alcohol and all these materials and the gloves, latex, lot of things, and personal protection equipment, everything. All these will release lot of VOCs, and it can create lot of trouble to the IVF lab, IUI lab, and altogether to the infertility clinic environment.
Thank you, doctor. So you mean that there's going to be a long drawn journey in terms of normalcy coming back to IVF centers and those kind of setups. It means,
yeah, definitely,
the lag period for or maybe the gap for the patients who are seeking this treatment or who were at the verge of seeking this treatment is going to be little longer, and the priority of also may change. So then I think it puts a lot of requirement for the self management. So may I take Dr. Milind Patil here and ask Dr. Patil that what do you suggest as a maybe nutrition guideline for these patients at home or post lockdown, or physical activity or lifestyle changes which helps them kind of prepare them better for the so that they can get better outcome once they start getting treatment post these restrictions are over?
Yes. Actually, I normally divide the patient in 3 categories. One is ovulation induction, second is IUIs and IVFs. And I personally feel in the scenario now, we are not able to give treatment to any of these categories without ultrasound, without adequate monitoring. So all these patients are now locked down in their residences now. So what best we can do is we can go in for some lifestyle modification, especially in obese patients, especially obese PCO, normal non-PCO obese patients also. So lifestyle modification includes everything. It includes a good diet. Now, of course, we have got professional dietitians, but now as because of the lockdown, we don't have that also. But then we can always give them a general guidelines. You have a moderate carbohydrate diet, which is having a low glycemic index, good protein intake. Of course, it's good for the COVID infections as well as for maintaining the body also. And good vitamins, minerals in form of fruits and vegetables, the grains, cereals should do well. And about the exercise part, I think now as the gyms are closed, you cannot go for any morning walks or evening walks and everything. If you have some instruments in your house, it's well and good, you can do that. But if you don't have, I think if you on your terrace, of course, mention without it goes without saying, maintaining the social distancing. If you can go do some walking inside your house also, or maybe jogging, and then some bed training, resistant muscle bed training should also go a long way. Even you can go for some good meditations because that will reset your hypothalamo pituitary ovarian axis to a good extent, and that this all these things do have a good amount of psychosomatic component in that, which includes infertility also. So correction with good diet, good exercise, good meditations, bringing down your stress level, which was inadvertently there and which we couldn't cope up with because of our lifestyle. Now we have an opportunity to get back to that normal stage, get back to the normal physiology, which may help in the ovulation status and everything else. So I think it will go a long way in helping these patients. So basic things: good diet, exercise, good meditation, reading good books, and just staying happy.
Wonderful, doctor. So it seems that having good food, good exercise, good lifestyle seems to be the key for most of the diseases these days. Keeps you, happy, healthy at home also. But COVID-19 has also posed a lot of risk in for the immunity of the people, and the discussion of immunity has come to the center stage. I take this question to Dr. Sujoy Dasgupta. Dr. Dasgupta, what is your opinion about COVID impacting the immunity of infertility patients, and how do you recommend, and is there a need for them to be extra cautious or work on their immunity a little bit more than anyone else? But the immunity is something everyone needs to build, but what are the extra precautions for infertility patients or couples? Dr. Dasgupta, is Dr. Dasgupta with us? I think Dr. Sujoy, you are on mute. Can you unmute your... Dr. Sujoy, you are on mute. Can you unmute? Dr. Sujoy, I think is not able to hear me. Maybe let me take this question to Dr. Krishna Kumar. Dr. Krishna Kumar, any specific guideline for these patients or the couples in terms of building their immunity or being careful about immunity a little bit more?
No, immunity basically, unless there is coexisting disease, especially PCO patients can have problems with their sugar metabolism. So they have to be taken care because PCO patient with diabetes are going to have different problem than a PCO patient not having sugar. So from that point of view, their immunity has to be definitely taken care of. They have to be, as rightly pointed out by Milind Patil, the obese PCO patient with a sugar problem should try and reduce their weight. Of course, eat all green leafy vegetable, and more than immunity, it is the stress level which they have to take care of. PCO patients have their own other problems, so they are going to be more stressed than the regular patients. So one has to counsel them that definitely reduce the stress level, use this time to concentrate on other things, and stress level once reduced may solve a lot of your ovulatory problems itself. So that way, I would say build your mental immunity rather than just physical immunity, because most of the infertile couples are that way young. So their immune status is otherwise supposed to be good, excepting those of PCO with problem with diabetes and other problem, or they are on some immunosuppressants, or they are going for chemotherapy along with infertility treatment, only then. Otherwise, per se, average patients should follow regular healthy green diet at frequent intervals, avoid too many fried items, and eat a lot of vegetables and fruits. That is what I would advise.
Thank you so much, Dr. Kumar. Let me also then take some final comment on infertility care from all our speakers. So I'll go to Dr. Durga first, and so what do you what is your advice, doctor? Maybe 3 points which these couples who were seeking for infertility treatment should go for or should be careful about.
See, whenever a patient comes in and we advise lifestyle modification, the first thing that they tell us is they don't have the time. Between work, coming to the hospital, and their own personal things, they just don't find time for themselves. So I think this is an opportunity that has been given, even though unfortunate, but we have to turn it to our advantage. And the most important thing that they can do in this time is obviously to correct all the things that were going wrong in terms of their lifestyle. Let it be smoking, let it be drinking, let it be weight, let it be in terms of the sleep pattern, and the diet that they had. So these are the factors in which they have to really put in all their effort in and correct these things and make it in such a way that they can follow all the changes that they've made even post lockdown. You can't just think this is the honeymoon period and after that everything is going to be fine. So they have to make measures in such a way that it'll be easy for them to even follow them post lockdown. And like Dr. Milind was talking about, what's very important is also the emotional and the psychological health. And we all know that exercise does help us in both of these issues. So get some amount of exercise into your routine in a day and ensure that you listen to good music, meditation if you require. There's so much of, things out there in the net that you can actually download and, listen to good things, read inspiring stories, listen to music, get an hour for yourself, do some meditation and look at these things. Because these are the things that not just for fertility, but it's going to help them overall in their own health, physical as well as emotional and mental health. So I think the focus should be more on that. And once the lockdown eases and we are back to work, then it will be that much easier and possibly that much more productive when they go for treatments as well.
Thank you. So look for better emotional health, go for good food again, and then music, a little bit of motivational content, follow that so that you are in a right frame of mind. Let me go back to Dr. Sujay Das Gupta because he was mute earlier. So Dr. Gupta, your advice, what these patients should be doing?
He's still
not audible yet. Can my team, Himani, can you check with Dr. Gupta once and see that what are the problem? Okay, so Dr. Sivani Sachdev, your comment on it.
Yes, let me tell you, just a few days ago in clinic, I had a patient who came in emergency and she had a small abscess and she was just crying, saying that I have cancer and my husband is saying, will you be able to save her? So definitely people are going through so much emotional turmoil that we are sitting in our home, we don't realize. They are reading these reports and they feel that they have some illness and they are not going to be able to be saved. So we have to be there to support our patients. They require a lot of counseling. And you raised an excellent point about immunity. And in fact, I had done a whole TV story just on this immunity building. Because this is one of the, it is not going to prevent you from getting the virus. But immunity is your soldiers. It is your protection as to how your body will respond to it if you get any infection. So according to me, it is very essential every day. You should have vitamin C, so you should have it in some form like maybe lemons or, santra or kiwi fruit or any form of vitamin C. Expose yourself to sunlight for some time because you should get vitamin D, and vitamin B complex is the whole group that you get from grains and green leafy vegetables. This group is very important. So try and make sure that you get each of these components every day to really boost your immunity. And if you feel anyway sad or depressed, go for meditation and call your doctor. Do not hesitate. Thank you.
Thank you. So, Dr. Kunji Moideen, what's your take on it, and how these patients should be looking forward to their treatment as well as the precautions?
Here I would like to comment on the point that, see, even though all the elective things, all the OPs have been stopped, we should not keep them away, or we should not shut our doors to these patients. At least we should be accessible to these patients and their relatives through some telemedicine platforms. At least junior members of the team on each center should be accessible for the patients through telemedicine platform, whether it is free or paid pattern. We already started in that extent. At least if they can talk to us, if they can see us, that itself will do a lot of benefit for them. At least they will be consoled to a great extent. They will be emotionally better. And I think we can give a lot of advices, as many of these speakers have already suggested, with regard to the diet, exercise, or how the earlier medicines have to be taken. For example, many of the endometriosis patients might be on continuous medicine for last 2 or 3 months, which may have to be continued for next 3-4 months again. So all these advices which we can give, and they will see us and we can see them. At least both of us, both the teams will be in a peace of mind that we are giving some care to them, and they are also having the peace of mind we are accessible to them. I think we all should take care of that emotional aspect as well. Thank you.
Thank you so much, Doctor. Dr. Kaveri Banerjee, your opinion about it, and what you would like to add?
Yeah, I think a lot of points have been covered, but what I note these days is that now that the home lockdown is coming to over a month for everybody, both the patients and the healthcare workers, and there is an indefinite, we are not quite sure how long this is going to go on. It has now become a question of the mind rather than any other issues. So, for our patients as healthcare workers, we would like to say that rather than going into the negative sides of stress, anxiety, depression, violence, which we are hearing, at least for our group of patients whom we are catering, the August panel, which all the points that they have highlighted, they must make the best use of this time. This is number one. It's very easy to go down the negative route, but you have to keep control of your mind and be strong. The second thing which I would like to say, that as healthcare workers and as government and as the group of lead clinicians that we all may belong to, we have to kind of now utilize this time to make stringent guidelines as to what to do in the future and transmit this message slowly to the audience and the patients. It can't suddenly be that lockdown is over and it is business to back to square one. There still will be social distancing, there still will be minimizing your patient inflow. So if this information can be first consolidated and then slowly disseminated, we must utilize this time rather than waiting for when lockdown is going to finish and then we are going to go to work. We must utilize this time to slowly kind of frame a plan and also make our patients aware. Dr. Kunji very rightly pointed out telemedicine, but we all know the challenge of telemedicine in India. We all know the patients have our mobile numbers, and we have made ourselves very accessible, which is all very good and which is all the right thing to give them the positive bent of mind. But imagine not letting them come in hordes to the clinic and utilizing that time and expertise on the telemedicine platform. There has to be a change in mind shift. So I think slowly and steadily, the government, the bodies, the patients, the public needs to now know that healthcare is going to take a different tune and we need to accept it.
Thank you so much, Doctor. So if I may just, sum up before we move on to our discussion on PCOD, that the important aspect which all of you are, kind of assuring patient is that the lockdowns are not going to have much impact on their fertility outcome. It may be delayed, but that can be recovered once the things come back to normal. I think that's what is most of the people anonymously saying. And the other important aspect is that utilize your time, focus on your food, health, mental condition, and many other, you look for preventing and improvement on other health, conditions which they may be having or facing. So that's what is, and then look for a little bit of a different way of accessing this service once the lockdown is open, because there may be some kind of priorities. People who require it first, they may be served first, or they may be helped first, and there may be people who may be asked to wait a little bit because they can wait for this. So, doctor, PCOD, the another major topic, and we have reached to 52 minutes of our discussion, and we are left with another 40 minutes. So, I think we should focus these 40 minutes on this discussion also, which is impacting almost, I think, every 10 among every 10 women, at least 1 or 2 women are having this problem, and widely discussed topic of among young women, that PCOD, which they are living with. So, Dr. Krishna Kumar, maybe I again start with Dr. Kumar, since you had mentioned about PCOD during our, one of the questions initially. So, what is PCOD? Just to begin with the very basic information about it, so that the audience which are watching, can understand the this medical condition.
Right, as you rightly said, polycystic ovarian disease. PCOD full form is polycystic ovarian disease, but we use another term called as a PCOS because it's a syndrome, polycystic ovarian syndrome, because it's not a disease itself. It is a condition where there are multiple presentation. Most of them, as you said, menstrual irregularities they have. Either they do not menstruate, or they very scanty periods. Many of them have hyperandrogenic features we call, like acne, pimples, hair growth in unwanted areas, darkening of skin around the nape of the neck, and of course they find it difficult to get pregnant. Those who are married, they find it difficult to get pregnant because it's a condition where the normal release of eggs, or ovulation we call, doesn't happen. These patients are known to have multiple eggs in their ovary, more than other women of the same age group. So this presents in this different form of this. But apart from this, they have certain other risk factors. They are known more prone to sugar problems or diabetes. They are more obese. Means PCOD tends to add weight, and once a PCO patient adds weight, it adds problem to the PCO. And long-term problems of PCO are too many. They can get cholesterol or hypercholesterolemia, they can get cardiac disease, and unfortunately, because of the continuous action of hormones on the uterus lining, they are a little more prone to cancer of the uterus. So all this is completely grouped as called as PCOS. And as you rightly said, we see roughly 20 to 25% of our infertile patients having this particular problem today. So this starts right from teenage, right from the time when they're hardly in that 13 and 14, and the weight gain starts, and irregularity and many of the anxiety starts from there. So this is in short about PCOD.
Thank you, doctor. Thank you. Very well explained. Dr. Durga Rao, what are the what a patient can do to tackle PCOD better? It's a hormonal disbalance, and causing certain problems, can lead to infertility, can lead to many other complications also. But what women can do around it? How they can make sure that either they prevent it, or if they have already developed it, so how they manage it better. Dr. Durga. Dr. Durga, you are on mute, I think. She's on mute. Dr. Durga.
They forget to unmute. That is where the problem is.
Yeah. Open your mic, Dr. Durga. Unmute your mic. All right. I think Maybe she is not able to hear me or something. Okay, let me take this question to Dr. Shivani then. Dr. Shivani, what do you think about how what a woman can do around it? What are the precautions or changes in lifestyle they should look for?
Okay, so first of all, you should understand that this is a problem which is very common in our country. It is said that almost 1 out of 10 women in our country is suffering from something which is called as polycystic ovary. This can affect girls in their school-going age group also, or when they are studying. It can affect women when they are trying to get pregnant, and it can also affect women who have already given birth to children. So if we start with the school-growing girls, if you see somebody who has like excessive growth of hair here or on the chin, or if they have some dark discoloration, or they are not getting their period, 80% of women will have very late period or very less period. Some of them will not get a period at all, except unless they take some medicine for it. So what can they do? So these are the group of people who I tell them diet and exercise. Remember, 70% diet, 30% exercise is going to give you a combination of a little bit of weight loss, and a weight loss is superior to any medication that any doctor can prescribe to you. So the control of PCOD is in your own hands. It is something that you're born with. It is there inside the ovary. It is not like a virus that you acquire from outside or an infection. So this is something which is there inside your body. So if you have this problem, remember for the rest of your life, you have to be very particular about what diet you eat and how much exercise you do. Your diet has to be low in what is called as trans fat. All this processed food that is there, pasta, bread, whole white bread, cheese, maida, like samosas, anything like this is going to be your enemy, and that is going to exaggerate your polycystic ovaries, and your period will become late. You will start getting excessive hair. So in your diet, avoid these processed fat, trans fat, avoid sugary food. Replace it with proteins. And that also, it is believed that vegetable proteins are supposed to be superior or better to animal proteins. Take sprouts every day.
Important cure or one kind of supportive treatment. Dr. Durga Rao, your mic was
Yeah, it got stuck.
so let me come back to you and ask that. Okay, so there are certain foods to be avoided, certain foods to be included when you are in the condition of PCOD. What is specifically, what is your opinion? What kind of food and how much of quantity? What to reduce? What to add in this situation?
I think Dr. Shivani has already sort of elaborated on that. But the most important thing, like she has pointed out, which I want to reaffirm, is the fact that even a little bit of weight loss really goes a long way. So we are really not looking at 10 or 20 kgs for them. We don't want to give them unrealistic expectations or unrealistic goals. It's very important to keep the morale of our ladies who are obviously undergoing a lot of emotional turmoil as well. And, everybody around them is telling them to lose weight, but they understand how difficult it is to lose weight as well. So I think we should be the most supportive person that we can be for them. And if possible, also, telemedicine, nowadays everybody is doing things online. A lot of diet counselors are actually available online for which they can access their services also. And it's important that we give them realistic goals. So basically what we're really looking at, let's look at even 5% of their body weight that we want them to reduce. So let's give them small goals which are achievable and also keeps their morale up. We should give them a kind of integrated care available online. Let it be a psychologist, let it be an online diet counselor, and obviously us as their primary physician. Even a little bit goes a long way, and if required, and if the physician thinks it's important, we could also give them a little bit of, other kind of medications, which should obviously be not the first thing to do after their lifestyle management in terms of their weight, their diet, and everything is controlled. We can also add a bit of metformin if we think that can be an added, stroke in terms of helping them improve their hormonal imbalances, because over the weeks that they have, everything might add up, and hopefully, who knows, they might just conceive by themselves instead of coming to us after a few weeks.
Thank you so much. So exercise is another important area, and not a very hectic one, but at least a mild and a certain balance, volume of exercise is needed. So let me take this discussion a little bit broader. This is an hormonal problem. So how, what is your guidance, Dr. Banerjee, for women to overall manage their hormonal imbalances, which may include your PCOD or maybe thyroid also. So, what is needed for them to keep a better balance of hormones? Please unmute Dr. Banerjee.
Yeah. So, as has been discussed, in the PCOD, we are looking at the various categories of ultrasound, the hirsutism, and the weight gain, oligomenorrhea. And along with this, there could be, of course, if there is severe hirsutism, then we have to rule out other causes of hyperandrogenism, like Cushing's, ovarian hypertrichosis. So these are very, very rare. But if there is too much of androgen secretion, which can manifest itself as high-grade hirsutism, and sometimes a formal Ferryman-Galloway scoring may be necessary. So that is a different aspect altogether. But if we come to the usual PCO that we see, yes, you are absolutely right. In them, hypothyroidism as well as hyperprolactinemia are also quite common. Now, in this earlier, we used to measure, even a decade ago, we used to measure the FSH-LH ratio, and hyper levels of LH was considered more difficult PCO. And not to say that that is not true at the moment, but slowly, the definitions have broadened, and FSH-LH currently are not so much in the diagnostic criteria as the symptomatology is considered. So when broadly, I can say that when a patient of PCO walks in, her weight, her BMI, the extent of her hirsutism, her overall appearance, whether there is android obesity or not, then her blood test, again, AMH is not a diagnostic criteria for PCO, but along with other evaluation, TSH, prolactin needs to be evaluated. Prolactin, again, if there is significant secretion, galactoria. So all these things, once corrected, slowly, if we correct the thyroid, hyperprolactinemia may automatically get corrected without adding cabergoline also. So, as you have rightly mentioned, then again, as Dr. Shivani, Dr. Durga have mentioned, the right diet will also correct the hormonal milieu. Lifestyle changes. Dr. Milind has mentioned about yoga and meditation. So, polycystic ovaries is an amalgamation of various hormonal imbalances, which multifactorially has to be corrected.
Thank you so much. So, after understanding the problem, the issue here is right now people who are living in lockdowns, when they face this irregularities in their periods, or they may be, a certain kind of symptoms which you all identified start appearing. Now, they can't, so what is the time when they should think that they have to take a decision to go to a doctor or consult a doctor? Because otherwise, in this scenario, it's a little difficult to consult a doctor. The accessibility issue is there. So when they should definitely go out and consult a doctor? And let me ask this question with Dr. I think Dr. Das Gupta joined in between. Is he here, or he has left? Because I think he was his, again, like mine, I think his internet is also not working that well. So let me then go back to maybe Dr. Kunji Moideen. Dr. Kunji Moideen, when a patient should, or a woman who may be having some symptoms of PCOD should decide to talk to the doctor, especially during this lockdown when the doctors are, a little bit not accessible maybe? Doctor, your mic is mute. I think.
Yeah. Audible now?
Yes,
Audible?
yes, please, sir. Please.
Yeah. Okay. In this situation, actually, most of the scenarios of PCO, they cannot come to the hospital because it is a highly elective thing. Only thing is that as per the general recommendations which are available from the internet or health education brochures or anything, they can, as all the speakers have suggested, the public can go for all the dietary control exercise and reduction of body weight and proper intake of proper proteins, less carbohydrates, less fat, etc. But they may have to come to a treatment because some patients they present with oligomenoric cycles, and some patients will have severe menorrhagia while during when they happen to get the menstrual period. In some situations, some patients they can get in contact with the doctor through telemedicine portals, and if the doctor cannot solve the issue by advising some medicines or hemostatic agents, the patient may have to come to hospital because of severe menorrhagia, which is not controlling with any medicine. Otherwise, with regard to infertility, they cannot come. They are not supposed to come because it is highly elective. Only thing is that they have to just follow the advice. Thank you.
Thank you so much. Dr. Krishna Kumar, what is the role of stress or mental well-being in supporting or complicating the treatment of PCOD?
Right. Now the PCO patients, you see, every woman in India at least wants their menstrual cycle monthly basis. 28, 30 days if they get, they are mentally very happy, very cool. The moment that menstruation doesn't occur in time, that itself adds to the stress because their peers, their mother, their neighbors, everybody will put something, you are abnormal. So the absence of menstruation causes severe stress to every woman, and especially when they tend to put on weight. PCO patients blame the weight or the absence of menses to their weight. They say that I have been putting on weight because my menses is not coming. But it is not so. It is the other way around. Number two, many of these women have a lot of abnormal, unwanted hair growth, abnormal pimples, and they are, as rightly pointed out by Shivani and all, they are teenage, they are in their college, they are in the school. So all their, this is adding to the stress because having pimples, too many hair growth in the chin, in the mustache area, abnormal, so they feel they're different from them, the others, so they definitely are more stressed. And once they get married, if they don't get menstruation, the family puts pressure on them that you are abnormal. Again, you're not going to get pregnant because you don't get menses at all. So how are you going to get pregnant? So that itself is an additional point of stress. So PCO patients in general are more stressed because of all these multiple factors. And fourthly, when they come for treatment, their treatment is very simple. Many of them will respond to medicine, but there are few who do not respond to medicine so soon. Their visits to the doctor is more than the others. They have to come for continuous medication, they have to come for monitoring, sonography, hormone tests, this test. So all these are adding not only financial burden but mental burden. So in all, they all are under more stress than the regular. So first thing is the family should help them. So at this point of time, when everybody is at home, they can talk to their family. The family understands the disease, and then they know that they are at the right treatment, they are going to the right doctor. That itself should add confidence. Yes, you are different, but the guidance being given by the medical personnel is perfect. That is the way you have to follow. So somebody should talk to them. They need counseling. So once the stress adds, the menstruation again becomes irregular. So stress is very going to be important, and at this point of time they should utilize their free time, as many people have told, that read, meditate, talk to your family, talk to your friends on the phone, talk to the doctor, get your stress level down.
Doctor, but even the outside conditions and the overall pandemic situation is also adding a lot of
Adding to the stress,
people.
yes.
Fear of job, fear of livelihood.
Yes, see, these are, forget about that. We doctors also are now having stress that tomorrow any person whom I'm going to come across as a patient, I feel whether he is COVID, we are going to get less patients. We are going to have, our hospitals cannot do regular surgery. So definitely we have to pay salaries to our staff. We have to maintain our hospital. Those stress each one of us has. But definitely, as you said, the job stress, whether company will retain you, they're all adding up. So forget the lockdown. The lockdown is just a temporary thing, but the whole disease has to resolve. And not only the disease, what after effects, what other effects we have to change, what are the way we are going to, as Kaberi said, the healthcare infrastructures. We cannot do, we do telemedicine, but that's only for a group of patients. There are so many in India who cannot really afford or who really don't know what is telemedicine is. And they all just want to walk to your clinic and see the doctor. They are mentally happy. They are mentally happy talking to you. And the way guidelines are going to come up, we have to add on cost, and all these costs are going to add on to the patients. So there are going to be a lot of things which we have to change. The way we live, we walk, we treat, everything is going to change.
Yeah. So we are going to, when lockdown ends, will be in a very different world with lot of new guidelines, and some of them contributed by you also, doctor. Let me go to Dr. Durga Rao, and we have got a question from Facebook. And one of the viewer is asking that, is PCOD inherited? And how to handle thyroid and PCOD without pills. And the second question about how to handle a thyroid and PCOD without pills, I will request Dr. Shivani to address that. But before that, Dr. Durga, is PCOD inherited?
See, there are certain data which is coming out to say that there are certain genes that are responsible for the presentation of PCOD. Now, there is also something called as Walker's hypothesis, in which we say that based on how the mother is in terms of her pregnancy, how she conceived, how she was during her antenatal period, and what her hormonal balances were, and what her, her status of diabetes and her weight and everything else, has an impact on how the child is, whether the child is going to develop PCOD when they are growing up or when they are in adolescence. So this is the reason why we have to actually control this right from the beginning. And when we are talking about the beginning, we have to ensure that the women who are conceiving have to have an optimal situation in terms of their health when they are pregnant, and also during their antenatal period, so that the future generations of these women at least can escape the concern and the diagnosis of PCOD. But yes, coming to your questions, there are certain genes which are responsible for the manifestation of this condition. And the most important way that we can keep it, maybe not completely remove it, but at least keep it in abeyance, is to ensure that the lifestyle modification that we have been speaking about is actually reiterated and brought into the minds of the kids even when they are in school. Because most of the bad habits that we have gained over the years is starting from our childhood. So this is where the importance of the atmosphere at home, how the parents are, how they are teaching their children, what kind of diet they are giving the children, what kind of exercises they are making the children go, rather than sitting in front of the television all the time. They should be having some kind of physical activity that will obviously change how an adolescent is going to be in terms of the manifestation of the condition. So things have to start very early for them.
Yes, thank you so much, doctor. So I believe our viewer has got the answer on this line. Dr. Shivani, how to handle thyroid and PCOD without pills?
Right. So first of all, let me tell you that there is no treatment for PCOD. I mean, it is not an infection that you take a pill and it goes away. It is going to be there with you, and the changes that you make, you remember, you have to follow them for a very long time. The most important thing is diet and exercise, which is completely in your hands. And if you control your diet and exercise, you will probably not even need any pills. Now, it is not just a problem of period. Some women get irregular period, but some women also have hair loss. Because the male hormone is excessive, especially from here, this area, they lose hair. If you are losing hair, what you should do is that you should increase the iron intake in your food. So all these red colored like beetroot, pomegranate, apple improve the iron intake. You might face a problem of excessive hair growth on the chin or dark color pigmentation. If you are facing this problem, then the best treatment for you will be to go for some cosmetic procedures. Like you can go for something like threading, bleaching, or electrolysis. Now, the other problem may be that you may find difficulty in getting pregnant. If that is the case, what you should do is that you have to follow a very strict dietary regimen where you reduce your trans fats and increase the intake of fiber, protein. If you're having coffee, absolutely stop drinking coffee. It is considered to be very bad and it increases your PCOD manifestations. Reduce, if at all you are taking alcohol or smoking, absolutely cut down on that. If your partner is smoking, advise them also to cut down. These are some of the home remedies which you can use for the various kind of problems that polycystic ovary causes.
Thank you. So you are saying by changing lifestyle, there can be a way to handle it, but people will certainly require to go to their doctors and then find out what will be the best treatment or management regime for them. In between, Doctor, let me come back to Dr. Konji Moideen. Doctor, what are the the guidelines, for example, for the patients to manage PCOD? If you can broadly put forward.
I didn't hear that question. Can you repeat?
I'm saying, what are the guideline you will like to put forward for PCOD patient, that how to manage it best, and when to and up to what extent, or whether they should go for some kind of home remedy, self medication, or it should be completely something where they have to seek the help of the doctor.
No, it is something. I think most of the things have been already discussed. See, they can very well go ahead to initially to start with the lot of things like especially the diet plans, the diet which is not containing high fat, the diet which is not containing carbohydrates, and the doctors also can advise them to do at least aerobic exercise at least 4 to 5 days a week, and that all they can do from home. And the home remedies as such, there are a few Chinese medicines and all have been described, but see, these do not have any evidence. And as doctors, we cannot advise them for these home remedies. And something, see, these patients, they might have already consulted a gynecologist or infertility specialist earlier, and they might have been put them on metformin, which they can continue. Some patients might be on OC pills, they can continue. Some patients will be on treatment for acne, hirsutism, all these things they can continue. But as such, there are a lot of new thoughts with regard to the microbiotas, in the gut microbiotas. But all these things are said to be connected with insulin resistance and the hyperandrogenism. And these gut microbiotas are part of the human body, and there is imbalance and inflammatory things can also affect their insulin resistance and hyperandrogenism. So in this situation, also the drugs like lactobacillus, which they can take or we can prescribe over phone or by telemedicine. See, these all remedies, they can take it at home without much supervision. And it can be, to some extent, it can be beneficial, even though these are the new thoughts and it needs more research to tell that this is effective for that and this is effective for the other purposes.
One small question, Doctor, we have got from Facebook, and I would like to put that to you. Can PCOD patient conceive naturally?
Yeah, definitely. Especially this is a golden opportunity. The COVID period is a golden opportunity because very often we get the phone call that, see, what's the medicine to take pregnant? We get the phone calls like Shivani mentioned. Every day we get phone calls telling that, doctor, I'm pregnant. Mostly these patients were waiting for either IUI or IVF with very low AMH, etc. These PCO patients are also just because they are controlling their weight, just because they are doing a lot of exercise, their all hormone balance are getting adjusted. So these patients can naturally get pregnant during this period, and this is the right golden opportunity for that.
Yeah, thank you so much. So, doctor, we are almost 5 minutes left from closing our this session. So I would go to each one of you once again, and will like to hear your broad guidelines for the various patients, both infertility patients as well as PCOD patients who are watching us, and that what are your 5 points, guideline for broadly for them. It may be just a repeat or recap also, because many new people might have joined on Facebook, so they can get 5 things which they should do in the whatever time left in the lockdown, or even if it get extended, or even beyond that, which helps them in taking care of their medical conditions better. And let me begin it with Dr. Kaveri Banerjee, and I'll go and I'll come to Dr. Krishna Kumar at the end of this to put his kind of overarching remark on the overall discussion. So, Dr. Kaveri Banerjee, over to you.
So, Mr. Kamal, do we have Hindi speaking audience also?
Yes, we have, and you can speak in Hindi, doctor, if you are comfortable. Sorry.
Yes. So I would क्योंकि हम लोग नॉर्थ इंडिया दिल्ली में प्रैक्टिस करते हैं, सो और जनरल पब्लिक भी इसको सुन रही है, एज अ डॉक्टर मैं ये बताना चाहूंगी कि पॉलिसिस्टिक ओवरीज को डिजीज तो कहते हैं, पर मोर इम्पोर्टेंट दैट इट इज अ कंडीशन. You should not feel that you're abnormal because you have polycystic ovaries. तो 10 में से एक लेडी को ये बीमारी या कंडीशन हो सकती है. तो ये अभी फैमिली सोसाइटी में बहुत इसको लेके चर्चा होती है, और जैसे पेशेंट की पीरियड्स रेगुलर नहीं होता है तो वो सोचने लगते हैं कि बहुत ही कोई सिवियर प्रॉब्लम है. तो पहले तो मैं ये कहना चाहती हूँ कि पीसीओ कोई बड़ी बीमारी नहीं है, ये कंडीशन है, इसको ठीक किया जा सकता है. और कई बार इवन इफ आपके पीरियड्स रेगुलर नहीं आ रहे हैं, आप बाद में नेचुरली प्रेग्नेंट भी हो सकते हैं. बाकी अगर आप ये सोचें कि पीरियड्स रेगुलर होने पर आप ठीक हो जाएंगे, ये एक गलत कॉन्सेप्शन है, गलत सोच है, क्योंकि पीरियड्स तो हम दवाई देके रेगुलर कर सकते हैं, पर इससे आपकी पीसीओ हल्की सी कम हो सकती है, पर प्रेगनेंसी नहीं हो सकती. तो बाकी इस पीसीओ कंडीशन में क्या करना चाहिए वो मेरे आगे के डॉक्टर दोस्त बताएंगे.
डॉक्टर दुर्गा राव, whatever language you are comfortable, Hindi, English, both.
I'll carry on with English. Sorry. So I think this is the time when we are supposed to actually clean up our lifestyles and spend a lot of time understanding that the health, it's not just about fertility, but it's also about every other aspect of life. And this is the time that has been given to us to actually ensure that the rest of our lives we have much more healthier outlook, and as well as reduce our doctor visits as well. Now, coming to PCOD and infertility, I would like to sum up to say that, here, this is where your weight loss, your diet is the most important thing. That is the foundation of everything that you will be facing forward. And only to make your treatments much more successful for yourself, make your treatments much cheaper for yourselves, I think this is the time that you have to put in your effort. And if required, we are always there at the end of a telephone line, and we are always there to help all of you in terms of your queries and to give you the right direction as to how we make your fertility journey much more easier. Thank you.
Thank you so much. Dr. Kunji Moideen, your final.
Yeah, dear viewers, and this is the right time, irrespective of infertility or PCOD, you have to stay at home and stay healthy. Because if you are healthy, then only you can mother a child in your future. Because that is the important thing, and have social distancing. You help your fellow human beings, because many people will be requiring your help. You assist them, give food to them, and your workers at home or drivers or any subordinates, you work at them. Contact them over phone, have video conferencing meetings with your staff, boost their energy level, reduce their stress. Recently we have organized some Zoom anniversary meetings where all the staff have contributed to the meeting by TikTok sessions. So like that you can reduce their stress, you can contribute a lot to them and these patients, and you have to control, like the previous speakers have told, you have to control your body weight. Don't overeat at home. Don't think that you can cook any experiments and eat everything, but eat specifically. You can see nowadays a lot of cookery recipes and a lot of videos are coming in. Don't eat all those things together at a time. So be healthy to eat, and don't stop the exercise. What you were doing at gym, do some indoor games and indoor exercises. Play with your family and enjoy the life, and you may conceive naturally and spontaneously. That's all.
Thank you so much, Doctor. Dr. Shivani.
Yes, so like Dr. Kaveri said, I will be talking in Hindi. तो आजकल जंक फूड बहुत ज़्यादा फैल गया है, और जंक फूड खाने की वजह से और पूरा टाइम अपने फोन, आईपैड, डिवाइसेस पे बैठने की वजह से फिजिकल एक्टिविटी बहुत कम हो गई है. इसकी वजह से हमारे समाज में ये जो बीमारी है पॉलीसिस्टिक ओवरी जिसे हम बोलते हैं, इससे बहुत लोग परेशान हैं। 10 में से 1 औरत को ये बीमारी होती है और इसका जो इलाज है ये आपके हाथ में है। आप अपनी डाइट कंट्रोल कीजिए, रोज कोशिश कीजिए ऐसी एक्सरसाइज करें 20 मिनट मिनिमम की हो, जिससे आपकी दिल की धड़कन बढ़े, आपको पसीना आए, उस एक्सरसाइज का फायदा है। बस ऐसे टहलने से फायदा नहीं है। तो आप कोशिश कीजिए कि घर पे कुछ एक्टिविटी करें, अपना जंक फूड का सेवन कम करें और इससे जो पीसीओडी की बीमारी है वो बिल्कुल चली जाएगी और इसका कंट्रोल बिल्कुल आपके हाथ में है। और मैं तो कम से कम 6 महीने से टेलीमेडिसिन कर रही हूँ। मतलब इससे अगर आपको कोई भी कंसर्न है तो यहाँ सारे डॉक्टर्स अवेलेबल हैं, आप फोन कर सकते हैं, वीडियो कॉल कर सकते हैं और परामर्श बहुत आसानी से कर सकते हैं।
Thank you so much, Doctor. Dr. Krishna Kumar, your final and overarching remark,
Right.
and also, showing the way forward for
Right. First thing is,
also.
of course, the polycystic ovarian disease. I would say, patients, please don't get depressed. Every infertility specialist will tell that it is far easier to treat a PCOD patient than other illnesses. Patients with PCOD and infertility have better chances of getting pregnant. So they stand always better. So that is the positive thing, because it's all requiring just minor modification. Yes, but right now, as already pointed out, stay fit, stay healthy, try to reduce weight, try to be positive. There is lockdown, but mind need not be locked. Keep it open. Talk to others, talk to your friends, reduce your stress and be positive. This lockdown will pass, and it is not the lockdown that is important. The disease will definitely pass, and all of you will get equal chance and better chance to get pregnant. So there is absolutely no worry on that front. Thank you.
Thank you so much, Doctor. So if I just, sum up and give the final remark to the audience of ISW Council, in last 4-5 discussions which we had on various diseases, one thing has come out very well, patients and the people who are watching this, that COVID-19 has hit us and has hit us very hard. We are all confined in our homes. There's no way to, and there are a lot of uncertainties involved. There are associated stress are involved. But what is in our hand is to make sure that we live our life in a most positive manner. We utilize this time to take care of our food habits, our physical exercise, our mental well-being, and look forward to opening up of our cities, our world, our country again, and then access the required healthcare with the best of your doctors and practitioners. Your doctors are available in between. Don't indulge into any kind of self-medication that can harm you in more than ways you can think about. So do get in touch with your doctor. They are all available. They are taking all kind of using technologies on WhatsApp, other apps to be available to address the problems of the doctors. Thank you so much, all the experts today who joined us, and we saw a lot of people watching this on Facebook. We have been getting questions which many of them were addressed by you. At present also almost 1.5 thousand people are watching, so thank you so much all of you for staying tuned with us, and we are looking forward to another discussion tomorrow on rheumatoid arthritis, and we'll be joined by around 10 experts of that specialty from across the country, and we will be discussing various areas and concerns and possibilities related to that. Thank you so much.
Thank
Good day
you.
to all of you.
Thank you.
Bye-bye.
Thank